Predicting the history of low back pain. Between the years 1997 and 2005, the total estimated expenditures for patients with spine problems in the United States increased 65%. In Europe, the yearly cost of low back pain is estimated at 211 euros per person in Sweden and 260 euros per person in the United Kingdom. A goal then would be to determine predictors for patients with low back pain that may account for modifiable or non-modifiable factors that may potentially influence these healthcare expenditures. Let's now review a study that attempts to do just that. This study represents a growing trend of practice-based research. The title of the publication is Predictors of Improvement in Patients with Acute and Chronic Low Back Pain Undergoing Chiropractic Treatment by Peterson et al., published in the Journal of Manipulative and Physiological Therapeutics in 2012. This study was conducted in Switzerland. As we will see, this distinctly unique approach to research is based on a principle of pragmatically studying patients in a real-world environment. Specifically, this approach is called clinically based research and by definition does not allow the restrictions of more scientifically based approaches, but does have the advantage of real-world extrapolation given the practice context. The purpose of this study was to determine if there are individual prognostic indicators of clinically significant improvement for patients with either acute or chronic low back pain managed chiropractically. 44 of the total 260-member Swiss Chiropractic Association contributed patients to this study, although not equally. Of the 44 participating DCs, 13, which represented 5% of all members, contributed 20 or more patients. The numbers of patients enrolled ranged from 5 to 85 per practitioner participating. Although there was no restricted prescription of management for patients in this study, researchers felt assured that there is relative uniformity in the approach most chiropractors take. According to the Swiss Job Analysis study in 2009, diversified technique is utilized with between 76 and 100% of chiropractic patients. The most common additional treatments include advice on the activities of daily living, trigger point therapy, therapeutic exercises, and mobilization techniques. Criteria for patients in this study were to include patients who were older than 18 years, had low back pain of any duration, and had not received chiropractic or manual therapy for the prior 3 months. Exclusion criteria were tumors, infections, inflammatory spondyloarthropathies, acute fractures, Paget's disease, and severe osteoporosis. The data collected was primarily the Numerical Pain Rating Scale, the Oswestry Disability Questionnaire, and the Patient Global Impression of Change, or PGIC. Secondary data included the patient's age, gender, marital status, work status, whether the pain was due to trauma or not, the working diagnosis, smoking status, pain medication use, duration and recurrence of pain, general health, and radiculopathy or not. Noteworthy is that 23% of patients were diagnosed with lumbar radiculopathy. Many previous studies used radiculopathy as an exclusion criteria with the bias that chiropractic management may be risky for those with nerve root involvement. All of these factors were compared and analyzed to determine their individual predictive ability to indicate a good or poor outcome with chiropractic treatment. Some interesting baseline characteristics were that trauma was reported in only 11% of cases. 28% reported their low back pain as their first episode. 25% were smokers, 38% were taking medication, 73% were still working, and 64% reported their health as good. With regard to response to care, for the 523 acute pain patients, at 1 week, 65% reported being better or much better. At 1 month, 81%, and at 3 months, 88%. For the 293 chronic pain patients, 32% at 1 week reported being better or much better. At 1 month, 59%, and at 3 months, 69%. Counter to common beliefs in previous reports, although 23% of the patients with acute low back pain and 24% of patients with chronic low back pain were diagnosed with radiculopathy, it was not a negative predictor of improvement. So what were the predictors? For chronic low back pain, trauma was a predictor, as was patient global impression of change at 1 week. Negative predictors were previous low back pain episodes and a high baseline oswestry. For acute low back pain, being male, and changes from baseline oswestry scores at 1 week and 1 month were predictive for improvement. For both groups, predictors included improvement at 1 week and 1 month. Those who improved at 1 week were 3 times more likely to be improved at 3 months. Also, change in the numerical pain scale at 1 week and baseline to 1 month. Those with improvement at 1 month were more likely to be improved at 3 months. However, none of the baseline variables independently predicted outcomes at 1 and 3 months for both patients with acute or chronic low back pain. The most consistent independent association was improvement at 1 week, which predicted improvement at 3 months for both groups. Let's look at some weaknesses and strengths. For this type of study, there were few weaknesses. Perhaps it would be more desirable to have a more even distribution of patients among more chiropractors. Obviously, this is not a study with a controlled environment and no control group, so statistical conclusions and extrapolations are not as strong. Yet, the study has a large sample size of 816 patients. Participation by practicing chiropractors was important to the pragmatic context of the study and make observations more relevant to the practice environment. This study demonstrated that patients, in particular with acute pain, improve rapidly and their gains are maintained. Once again, this study confirms what recent studies report, which is that patients with radiculopathy can be treated safely and effectively with chiropractic management. Many other factors, such as smoking status, age, and working diagnosis, were not predictive for patients treated chiropractically. So, although logical, this study demonstrates that rapid improvement, which often occurs with chiropractic care in this study, is still one of the strongest predictors of improvement for patients with either acute or chronic low back pain.